Go.
Hello, so my name is Caitlin, and this is Kayla, who we're going to be observing today. We're going to be going through hops, so we're starting out with history. Our first history category is...
I'm sorry.
Is activity of daily living. So we would ask questions like, what's your name? I already know our name. So, what's your occupation? What's your sport? What terrain do you play on? How high is your activity level throughout the day? Do you stand on your feet when you work? Does your injury hurt before or after activity? And all that good stuff. And then our second category is primary complaint. So you would ask them if you could use one finger to point exactly where it hurts without moving it. So they don't like circle around or like do a big area. You could also ask them, where do you feel the pain the most? Where does it hurt the most on a scale of 1 to 10? Has the pain spread since it last occurred? And stuff like that. Alright, moving on to mechanism of injury. So you could ask them, how did it happen? Like, did you get hit when you were in the air? Did you get hit by an object? Did you like fall on it? Were you performing any extraneous or abnormal activities in your daily life? Did you change your activity or technique? Like, did you run on a hard surface, or did you like try to do something like kick the ball weird or tackle someone bad? The next category is characteristics of symptoms. So you'd ask them to describe the pain, whether it's dull, tingling, aching, and yeah, burning or sharp. Yeah, because each of those different symptoms mean something else in the body. You could also ask them if it is weight bearing or did you lose any feeling at the site of injury. You could also ask them if it is tender to touch, or are there certain movements that restrict it? Love life. Alright, moving on to limitations. Can you run, walk, stand, jump, all that good things? Or can you, how far can you bend or straighten your knee? Is it weight bearing? Again, has your injury affected your daily routine? And then lastly, you ask them past history questions. If this pain is reoccurrent, or have you had surgery on it before, or have you injured it before? And yeah, that's it. Moving on to observation.
Go.
So for observation, we would first look at the anterior view. We would first observe the alignment of the toes and the position of the foot in the relation to the limb. So we would look at like what angle that the foot is at compared to... Yeah, she has weird feet. She normally stands like this. So we would also look to see if there's any ingrown toenails or claw toes. Okay, moving on to the medial view. Yeah, that's what I like to see. So we inspect for like the high arches. So we would inspect like right here. She's got a pretty good arch. We would also see if like they have flat foot or prominence of the medial midfoot. So like if their arches were really high or really flat. Hers look pretty nice. Alright, moving on to the lateral view. So this view we would inspect the ankle for swelling or prominence of the posterior calcaneus. So we would inspect this part and this arch. And yeah. Okay, moving on to the posterior view. In this view, we would assess the alignment, which should be a neutral or slight valgus. So valgus means that it should be like inward a little bit, and it is. It is. We would also look at the Achilles insertion, and we would like see it like on little kids. There could be a little bump for like Seaver's disease. And Now we would look at her standing on her toes. Her heel should move inward, which means that it's like varus, so it's inward. She's perfectly fine. Awesome, you can go down. And now we would look at how she would walk. So it should be equal strides, and the foot position and weight distribution should be the same. And the foot should also be 20 degrees, 0 to 20 degrees of external rotation when walking. But she doesn't do that because she, again, walks like this. Normally. Awesome. All right.
Go.
So also in the observations, we would have to look at the supine of her foot, and we would look at the nails, and we would look to see if there's any ingrown or hamartoes or calluses or warts, or we also want to see how far she can spread her toes. And again, we can look for like fungus and stuff in between. Next, we would move on to the prone part of her foot, and at the bottom we would look for like calluses or like blisters or warts or any cuts she has. We could, okay, yeah. Now we have moved on to palpation, which is the third category in hops. First, you want to look at the medial. Come over here. You look at the medial side of the foot, and you look at the tibial nerve, and then you move to the lateral side of the foot, and you look at the peroneal nerves. You can, yeah. And then you look at the posterior side of the foot. Look at that. And then you palpate for the Achilles tendon. You want to check for swelling or tenderness in all of these areas. And then you can also palpate the talofibular ligaments and the calcaneofibular ligaments. So they should be right here and right here. And there shouldn't be any tenderness and swelling. So she's looking pretty good. Next, you would look at the plantar fascia, which is the bottom of the foot. And you would just make sure there's no tenderness or swelling. You can also palpate the sesamoid bones to make sure she doesn't feel any pain or tenderness there. To check for the peroneal nerve, you'd want to push on it, and if she jumps, then she feels pain. Also, you look at the metatarsal phalangeal joint, and you want to palpate in between those because she could have a Lisfranc fracture, in which would hurt very bad. So next we're testing the range of motion. So, yeah, come over here. So she would have to put her foot normally. Yeah, there we go. And then when she dorsiflex, you should be able to move this magical pencil about 15 to 20 degrees. And then when you put your foot normally again, and then plantar flex, it should be between 40 and 50 degrees. And if you ask her to evert, it should be between 15 and 20 degrees. And then if you ask her to invert, it should be between 20 and 35 degrees. Okay, so now we're doing muscle testing. So first, we want to test the posterior tibialis. So we would put our hand on the inside of their foot and have them invert. And we want them to resist the pressure I'm pushing on them. And then the next one we would test is the anterior tibialis. So again, they would evert, but they would try to dorsiflex as well. So you want to put pressure on the inside and on the top. The next muscle you would test were the peroneus longus and peroneus brevis. And this time they would leave their foot normal and then try to dorsiflex with resistance. And then the next one would be the halicuses, so the extensor and flexor. So the extensor, you would test how well they extend their toes, and the flexor, you would test how much they can flex their toes. And then the last one is the gastrocnemius. So you'd have them start in dorsey and then have them plantar flex with resistance.
Go.
Ready? All right, so we're going to do our special test, the last category in hops. Woo! Okay, so first we want to put our hand at the calcaneus or wrap around the calcaneus, and then the other hand stabilizing, and you're going to pull up and test this is the anterior drawer test, and it just, you want to make sure there's no looseness. Alright, good. And then the talar tilt test, so you can do the eversion one and the inversion one, or the varus and valgus, and you just want to test their deltoids and their ligaments on the other side for any looseness or pain or resistance and all that stuff. Next you would test their metatarsal phalangeal joints, and so you kind of just like make sure there's no looseness or pain. And then the last one you would do is Morton's neuroma, and so you would just poke and make sure she's not jumping in pain. And yeah, that's pretty much it.